With so many different joints that we're seeing throughout the human body, we needed to make the classification, and that is why in the previous section of your course notes, you were reading about two different ideas of classifying the joints on the basis of their function or on the basis of a material being used to form the joint. So, if we would talk about structural classification of joints, you and I were talking about fibrous joints. Then we talked about cartilaginous joints. And finally, we came to a group of joints that are called synovial joints. Quality of synovial joints, of course, is a very minimal space that exists between two bones or more that form the joint, and that space becomes filled up with a synovial fluid, which essentially is lubricating articular surfaces and the cartilage that covers the articular surfaces of a bone, enabling bones to move relative to each other without any friction. Different type of classification was if we wanted to follow the function of the joint. And as we know, most joints really need to perform and produce significant amount of movement. That's why we said that these joints fit into a group that we call the diarthrodial joints, joints that are easily movable. Then we have joints, union, better to say, between two or more bones, where movement is not anticipated or expected, like what happens again between multiple bones of the skull cap. Clearly, movement would not be preferred because then we would have a poor protection for a brain. While when bones of the skull cap get united with each other through sutures, then we say that this joint or union between bones actually offers no movement. So these joints then become known as the synarthrodial joints. And the category in between them, so-called the amphiarthrodial joints, is for the joints where movement obviously happens, but happens within a range that makes it sometimes very difficult to detect from the outside, or even if we would have these two bones connected in our hands to try to induce the movement, might not be possible for us to easily detect it, such as thing between multiple vertebrae of the spinal column as they move a relatively minor uh, distance from each other. But because we have 24 joints of that kind, when you just allow them to compound, of course, then the movement becomes quite significant, and we can easily see that our spinal column produces the movement. But individually, between two adjacent vertebrae, we would prefer to say that the type of joint that their bodies make is actually the amphiarthrodial joint, where movement is present but somewhat present, not quite obvious. So I suggest that we take a quick look together and confirm what typical synovial joint would look like. And also we need to say that there are six different subclasses of synovial joints, and I would prefer to accompany that part with also a couple of words. So let's go and share the screen, which we have here, and I need this slideshow to help us out. That is the typical synovial joint. As you can see, two different bones come very close to each other and they make the contact through their articular surfaces that are covered most typically with a hyaline type of cartilage. Well, in order to keep these two bones together, synovial joints usually demonstrate appearance of fibrous capsule. It is like a sleeve which attaches to both bones that form the joint, and practically the fibrous capsule becomes the principal force that keeps bones together. With addition of ligaments, we're going to have additional uniting moment, but also ligaments will determine the range of motion. Fibrous capsule most of the time does not want to be the one that determines the range. It generously leaves it to ligaments. Fibrous capsule internally is lined up with a membrane that is called the synovial membrane, which essentially is lining the entire internal aspect of the joint, with exception that it does not cover cartilage that is covering articular surfaces. So practically the synovial membrane will reach the most peripheral margin of the cartilage, and this is where it's going to stop. Synovial membrane is highly vascular, and that's why it is able to filter out the blood and to release what is called the synovial fluid into joint cavity. The fluid itself nourishes the cartilage, but it's also keeping it wet, slippery, eliminating friction between bones as they move. Because this is the typical composition of synovial joint, let's now take a look at these 6 small diagrams and let's find out exactly what is the classification of just synovial types of joints. Based on some qualities, which essentially is the movement, we're talking about uniaxial, so joints where movement happens only along one axis. Then we have a group of biaxial joints, where 2 different axes will be seen in order to allow the movement. And then finally, we have multi-axial joints that are practically just one type, that is the ball and socket. And we'll take a quick look together at this diagram. For uniaxial joints, you're going to have them on the left side of the screen, one on the top of another. The types that we're talking about are planar joints, the hinge joint, and then the pivot joint. They're all uniaxial. So for these bones that are creating the posterior part of our feet, these are tarsal bones. Their articular surfaces are mostly flat, making a direct contact, but because these bones are very densely packing the area, essentially they don't leave too much of a space for each other to keep producing some kind of significant movement. Movement becomes reduced to minimal sliding and gliding movement, and I think that you can imagine this, for example, if you walk barefoot on a perfectly flat surface, like let's say in your home, and then accidentally you step on a golf ball or something that is of that size but also quite firm. Of course, that kind of impact that the golf ball is going to make against your plantar surface of a foot may force these bones to slightly adjust their position, so you would not lose the balance, but rather the foot itself will be able to absorb the impact of a golf ball by producing this kind of minimal gliding and sliding movement. Hinge joint, as we're a little bit more familiar with this term, all of our doors are attached to their frames through hinges, obviously 2 pieces of metal connected together with metal pin, and that is essentially the axis that we have as something that opens us, allows us to open and to close the door. In a human body, proper example of a good quality hinge joint is the elbow. So we can see here that there is a cylindrically shaped trochlea as the articular surface that is going to fit perfectly into its own trochlear notch on the upper part of the bone of the forearm, which is called the ulna. So they create already, by shape and size of these 2 bones and their articular surfaces, fairly good union, and this joint certainly is one that becomes quite stable during the life. Third type of uniaxial joints, again, we prefer to illustrate between 2 bones of the forearm, the ulna and the radius. On this mechanical model, you can think of it as a wooden block through which you drill a hole. And into that hole, you inserted appropriate size cylinder, which is allowed then to keep spinning either clockwise or counterclockwise. Of course, ulna together with this annular ligament, is going to become this block through which we drill the hole. And it is the head of the radius, which is looking like a perfect cylinder, that is inserted into this opening between the bone and the ligament. And certainly the head of the radius is capable of producing spinning or pivoting movement in a clockwise or counterclockwise direction. The result of the movement between radius and ulna is going to be something that is very important for overall quality of movement of the upper limb, as the radius and ulna produce pivoting movement, and the result of that is our ability to put the hand in two different positions. Supine, such as this one, when my palm is facing superiorly or upward, and then the opposite, pronation, where the palm is facing downward. So there are three uniaxial joints. Now let's take a look at biaxial joints. What characterizes them is that their articular surfaces have to be somewhat very awkwardly curved. What we have as a good example of the condyloid joint, it is our attachment of hand at wrist to the rest of the upper limb. As you can see, we can easily move the hand in a forward-backward direction, doing flexion and extension. But utilizing a different axis, we're able to move the hand in a side-to-side direction, such as it would be abduction or adduction, that we also call the radial or ulnar deviation. This is radial deviation, when the hand swings towards the radial side of the forearm, and this is the ulnar deviation, that is hand being moved sideways closer towards ulna. As you can see, articular surfaces are generated by the distal radius, and two bones of the carpal region, the scaphoid and the lunate, are going to make the complementary second articular surface. And of course, we can see them as a combination of articular surfaces that are biconvex, that is scaphoid and lunate combination, convexity runs side to side and front to back, and the radius, which offers biconcave articular surface, where the concavity is running also side to side and front to back. So we have a perfect combination of one articular concave and one articular convex surface that we fit together. Second type of biaxial joint, which is called the saddle joint, is very unique, as the articular surfaces are neither convex or concave, but they're also not flat. Articular surfaces are very complexly warped, so from one direction they look like convex, but from the other side they look like concave. That's why we're comparing it to horse's saddle, which when you see from the side is concave in a front to back direction. This is where the rider will be comfortably seated. But if you take a look at saddle from the front or back, it actually creates the convexity in order to adhere better to the back of the horse that we are saddling. So articular surfaces in this case are convex concave, and one joint in particular is very importantly benefiting from being a saddle joint. That is joint between trapezium, one of the 8 bones of the carpus, and first metacarpal bone, the one that belongs to the thumb. As a combination of this complex saddle joint movement, which is both a flexion as well as adduction, practically we're creating a very unique movement for the thumb, and we call it opposition, that the thumb could be completely opposed against the palm, as I'm doing right now, and practically from behind you can say that the thumb has been completely hidden within the palm. That is opposition, and its opposite, the reposition of the thumb. Finally, we have the last group, which is ball and socket, as the only representative of multi-axial joints. Obviously, it's going to be shoulder or hip joint as illustrated, where one articular surface looks like being inside of the cup, and the other one is quite obviously a sphere, something that will remind us of a ball. And as I can easily demonstrate at the shoulder joint, we can utilize multiple axes of movement because without a problem I can raise my arm forward as well as move it in the opposite backward direction. That is flexion and extension of arm at the shoulder. Then I can also take it away and back to the midline, so I can abduct and then adduct. And the third axis that you have to imagine as running from top of the shoulder towards the elbow is type of movement where my arm effectively becomes rotated inward, medial rotation, and outward, the lateral rotation.